And we're live. Welcome
Hey.
everyone to BlogPaws Cares and BlogPaws Shares. And this is our bi-weekly Google Hangout. We may go to weekly at some point because these are pretty popular events and shows that we put on. Today, BlogPaws is very excited to welcome Dr. Patrick Mahaney, who has been, by the way, a big supporter and friend of BlogPaws from the very beginning. I'll never forget seeing you stand up in the audience and ask questions of one of the keynotes, Patrick, and it just impressed me. I just thought I have to get to know that person even better. Well, Patrick today is going to talk to us about cancer and dogs, and he has an extensive background that I would like him to tell you a little bit more about, and I hope that you will ask questions, and if we don't get to your question during the talk, we will certainly address the question after the talk. So Patrick, welcome to BlogPaws Cares and BlogPaws Shares.
Thank you very much. I'm happy to be back. I did one of these this summer. Hold on, I'm being joined by a special guest right now.
Excellent.
He's just coming into the picture.
Cardiff is in the house.
Here we have Cardiff, who's kind of the inspiration for today's talk, and he may want to be part of it by sitting here, or he might get a little squirmy. We'll kind of see how he does.
Okay.
I just want to let him do his thing. So I'm Patrick Mahaney. I'm a veterinarian. I'm a certified veterinary acupuncturist, and I'm also a certified veterinary journalist. I've been in practice for over 15 years. I went to University of Pennsylvania for veterinary school, and I've actually practiced all over the country. I was in Washington, D.C. for about 5 years, in Seattle for about 6 months, in Olympia, Washington about 6 months, and I've been in Los Angeles since 2008. And I actually kind of like fortuitously moved here. I had a job bring me here, and this is always where I wanted to be, in Southern California, so it worked out perfectly. And in 2008, actually 2006, I completed my veterinary acupuncture certificate with the International Veterinary Acupuncture Society, and I went about getting that kind of certification because I've always been intrigued about complementary and alternative therapies that I could use for my own health. Having been a chronic back pain sufferer throughout my life, I wanted to figure out how I can make my body healthier, so I need less medication to control my pain. And so I went through this fairly long veterinary acupuncture training class, and then developed a small practice on a house call basis, doing it for pain management, mostly for older dogs and older cats with arthritis or back problems, but a lot of my patients also had cancer too, and there was really the need to offer more services than just acupuncture. So I started offering kind of whatever needed to be done: blood testing, blood, urine, fecal testing, consultation about herbs and supplements. I even took on a lot of puppies and kittens from their early on years, just because pets ultimately do pass on at some point, and we need to work with the family throughout it. So it's been a great process, and I really enjoy my practice. I work very closely with my clients in their homes. I get to know them very well. I usually work with them for years upon years, unless they end up not getting another pet if a pet passes away. So it's provided a lot of insights, and the Chinese medicine approach is really something that can be incorporated into day-to-day practice, especially when it comes to trying to prevent certain diseases from happening. So that's kind of where I am practice-wise now. I actually just practiced for myself, and then I took that house call model and I put it into a cancer treatment facility in Los Angeles called the Veterinary Cancer Group, which actually, among 5 locations in the LA area, is the largest cancer treatment facility in the country. Just because I had all these older patients that had cancer too, people were coming to me for acupuncture, herbs, or nutritional consultation, I figured might as well create a little bit of a home base. So, so that's been great to have that kind of relationship, especially in the fall of 2013 when Cardiff, who's right here below the lower thirds.
Cardiff, and we want to hear more about that and about Cardiff and some of the things that I know that are pet bloggers who have either dealt with this on some level or probably know someone who's dealt with cancer in a pet. They might want to know something like clinical signs to be aware of. Can you speak a little bit to that, and maybe how you discovered Cardiff had cancer?
It's a good question. It's always a question like when you're trying to figure out if your pet is having cancer from their clinical signs and the relationship you have with your vet. It's always a horrible process to go through, just kind of waiting for that answer. Do they or don't they? So Cardiff is he's a Welsh Terrier. He's almost 10 years of age, and he's had some health problems throughout his life. So I'm very hyper aware of all his day-to-day nuances of health or less than ideal health. So he's had 4 bouts of a usually fatal immune system disease called immune-mediated hemolytic anemia, or IMHA. It's
Wow.
basically an autoimmune disease where the immune system turns on and starts destroying the red blood cells. So I've been very vigilant throughout his life at taking steps to try to reduce the likelihood this disease will happen. I minimally vaccinate him. I just do vaccine antibody titers. He eats a diet all based in whole food, just like I would eat myself, real meat, real vegetables, real fruit. I try to avoid toxins and too much stress. I brush his teeth every day, so there's very little inflammation or infection in his mouth that could trigger his immune system. I manage some of his arthritis from a holistic perspective, so he's getting naturally anti-inflammatory supplements instead of needing to take medication. So I'm always like super aware of everything that's going on with him. And in the fall of 2013, Cardiff started to develop some clinical signs that had some similarities to his previous bouts of IMHA. He developed lethargy, so he was more tired. His appetite decreased. And he also then developed a couple weird signs too. He had a couple small seizures, petite mal seizures, where he just seemed kind of off and a little dazed. Actually, it kind of looked like how pets sometimes will react if they're having a bee sting reaction. So being we live in West Hollywood, there's a lot of flowering trees that drop their flowers. I thought he might have got stung by a bee, but then I kept on tracking the progress, and he was having these little mini seizures a little bit more frequently. And then he developed a couple episodes of regurgitation where the food he had eaten hours before would suddenly bleh, just come back up, looking basically how it just went into him. So I said, okay, something is wrong. I've been regularly doing blood testing on him, but blood tests don't always show you everything that's going on. So we then took the next step. And
when you were tracking, I'm sorry to interrupt, but when you were tracking, does that mean you actually had like a little diary where you wrote everything down?
Well, I do keep. I have a medical record that I keep on an ongoing basis for him, and also I keep entries in an iCal calendar just so I can immediately access it because I'm constantly having to give him medications and track blood testing. But fortunately, with the laboratory that keeps track of his blood testing, they have this whole graph system that lets me see plus and minus, so you can kind of determine when there are changes. So I was always doing this very specific tracking for him, but then things were different. So we pursued some, whenever you think that your pet is having a problem, it's always important that you right away take your pet to the vet and don't wait for 5 days, a week, or something like that. So right away I was taking Cardiff into a facility where I could get some x-rays and also test his urine, because that's one thing I hadn't done recently. And the x-rays didn't really show anything. So I was starting to treat him as though he had maybe just some kind of digestive tract upset, but that didn't really help. He never bounced back to quite how he was before. So then I thought, okay, there's something probably more serious going on. We need to take the next step. So we pursued an abdominal ultrasound. And that ultrasound revealed a small tumor on a loop of small intestine. And unfortunately,
now, did you determine that when you took him to the vet? I'm trying to think of it from the perspective of a pet parent who
Sure.
I'm looking at these signs, whether they're clinical or just why is my dog acting strange, and I take my dog to the vet. How many vets are going to be up to speed on, gee, let's do an ultrasound or whatever?
I think it depends on where the pet is in the process and what has already been done. Typically starting with blood testing, urine testing, and x-rays is a very common baseline, because especially with a dog that has a chronic history of illness or a dog that's older, there's more likelihood that more serious ailments can occur.
Okay.
So if you were to bring your dog to the vet and said he's lethargic, he's not eating as well, he's having some regurgitation, that vet hopefully would think, okay, we need to look a little bit deeper and see if there's a problem, instead of just, okay, let's take a wait and see approach.
Right.
But part of it does depend on how proactive you are and
how well your vet knows your pet. So
that's a good point.
That kind of, on a little aside, goes to something BlogPaws promotes routinely is more than once a year to get vaccinations. More than that once a year checkup. Your vet should be seeing your pet on a more regular basis, and especially as they get older. So my little Olive, who's a Boston Terrier and was earlier snoring up a storm, by the way. She's in the other room. We could hear her all the way in here. You know, she's getting a little bit older, and she's had a couple of teeth cleanings and a number of teeth removed. So she's someone that I would, as a pet parent, probably be a little more tuned into to take her to the vet. And Emily pretty much acts normal and seems normal and whatnot, although she has seizures occasionally. So, you know, as a pet parent, should we go every couple of months, even if the dog seems fine?
For your typical healthy adult dog, I like to have them seen by a vet about every 6 months, because you have to think about the dog is aging a lot faster than people do. There's the common adage of 7 years of dog life to 1 year human life, which isn't really true across the board. A lot of it depends on the size of the dog and their overall health status. Like larger dogs and purebred dogs are a little bit more prone to ailments that would occur as their body ages. Smaller dogs a little bit less so, but smaller dogs are much more have an issue with their teeth. And so we want to really make sure that we're sticking on top of all problems and preventing them from becoming more severe. So every 6 months would be a great time, or more frequently if the pet is sick, if they have to be on medications to control their health, and sometimes more frequently. So it's a matter of like determining the frequency that works best for you. Most pets yearly is pretty common, especially because you might get that card in the mail that says a vaccine is due. And so that brings the owner into the hospital, and then you can have further discussion about the pet health.
So I see a question from Carol Bryant, and I think, Carol, we're probably going to get to this in a couple minutes. She's asking, she says, IMHA is common in cockers, and what advice would you give about prevention? But before we get to the prevention part, I mean, I'm interested in the Cardiff story and some of the treatment options. I think it's very interesting. We were talking earlier before we got on air, the treatment options you were discussing. Tell us a little bit about those, and then we'll get into prevention.
Sure. So in Cardiff's case, we found out what seemed to be the source of the problem on the ultrasound. It was a tumor that was impinging the flow of food and fluid through the intestine, literally like pinching it down so nothing could move through. So this tumor was creating an obstruction. And in order to determine what was going on, the options were to try and get a sample of it with a needle going into his belly.
Okay.
So we could get get a biopsy sample. Unfortunately, the tumor was so deep in there and like close to other organs that we couldn't get that sample, so the best option was to do an exploratory surgery. So the next day, I co-participated. I was the assistant in the surgery because I don't really have a surgical practice anymore where I'm doing the surgery, so I deferred to somebody else who's doing it a lot more often, and I assisted, and we found this tumor just as I thought it would be. And removed a very large piece of intestine, like a piece longer than this with the tumor right in the middle, and also tested some tissues in the area to see if there would be cancer cells there too. Like your intestines are like a big piece of spaghetti all connected by a webbing, and so there are lymph nodes in there that drain your intestines. So we had to biopsy some lymph nodes, and fortunately all the tissues that we tested besides the tumor showed no cancer cells, but the tumor showed a very severe diagnosis called T-cell lymphoma. And lymphoma is malignant white blood cell cancer, meaning these are cells that are the DNA is altered, the cells are rapidly dividing, that's why they form tumors, they take up space and destroy normal tissue. So I knew right away that his diagnosis wasn't good, but it was kind of a best case scenario because this tumor was cut out, and we couldn't at that time find any more cancer in his body. So that was a very good thing to find out. But then we had to decide, should we put him through the almost 8 months of chemotherapy, or do we feel as though, okay, we did the surgery, we cut out the cancer, we can't find it else, is that enough?
Yeah. Okay, so talk to us about that, because you mentioned earlier some Chinese treatment things and things that the average pet owner doesn't know about.
Right. Well, so there I was, like, left with this decision between myself and my husband Phil and the veterinary oncologist Mary Davis that I work with at Veterinary Cancer Group. Should we do chemo? Should we not do chemo? The cancer was gone, but there's always the chance that new little tiny cells would form new tumors. And so I wanted to give Cardiff the best chance to have a long life and a good quality of life. So and he was also very healthy at the time. Like, he wasn't having an IMHA episode. His heart and lungs were good. His liver and kidney values were all good. So it was really the best opportunity to try to prevent new tumors from forming. So we elected to pursue this almost 8-month course of chemotherapy. But of course, I knew that I had to support his body through that process too. So chemotherapy kills rapidly dividing cells. That includes cancer cells, cells in your bone marrow, cells in your digestive tract. So when pets go through chemotherapy, very commonly some of the side effects we'll see will be digestive tract signs like decreased appetite or vomit or diarrhea, or bone marrow suppression where red blood cell production is down, or white blood cells, which are your immune system fighting cells, or your platelets, which clot your blood. So I wanted to try to support his body through that process. So besides the chemo, he got nutraceuticals, which are basically food-derived substances that have medicinal qualities, what you would consider supplements. So probiotics, number one, beneficial bacteria to try to keep his gut levels very healthy, because when you have all those gut cells being damaged by chemo, the bacteria balances can get all thrown awry. So I really wanted to keep his gut as healthy as possible. So he got a great company is called RX Vitamins for Pets. It's a veterinary company that makes supplements for vets, designed by vets. I know the owner, Robert Silver. He's a super brilliant guy who has taken all these steps to try to help animals like have better lives, hopefully with less medication. So one of his products called Nutrigest I use because not only is it beneficial bacteria, it's ginger, which is very soothing for the digestive tract, cat's claw, which is a very potent antioxidant, glutamine, which is an amino acid that feeds intestinal cells. So I was trying to every day support Cardiff's gut so he could have a better appetite and not have vomiting and not have diarrhea.
Absolutely.
And then when he would have more of a sign, like certain chemotherapy is a little bit more likely to have a toxic effect, so sometimes he did have some vomiting or diarrhea, and I would use other substances to try to help to soothe the inside of the gut. The same company, RX Vitamins for Pets, makes a product called RX Clay, which is actually kind of like a Pepto-Bismol, we'll say, just for reference, that can soothe the intestine and make it less likely to have vomiting or diarrhea. So those were two main supplements. He also got a Chinese herb, which is a veterinary-specific product from a company in Florida called TCVM Herbal, where veterinarians actually go and get trained at the Chi Institute. So this was a herb that supported his immune system and promoted proper formation of white blood cells so he could fight infections even though he was being immunocompromised by his cancer. Those were two of the main ones that he got.
It sounds like, as with any major disease issue, cancer is a big, scary one that we hope we don't have to face. We've got Christine, or Karen Christine Hugg, saying you explain everything so well, and I agree with her. You're going into details and helping us as pet parents understand. And Layla Martin also is glad to hear that you include alternative options in your treatments. Tell us why you are looking at alternative options, and tell us a little bit about, gee, where do we go for those kinds of things? You know all of this. You're a veterinarian. You're in an area of the country which is focused on health and probably some alternative treatments and whatnot. Where does the average pet person go?
Sure. Well, say your pet does get the diagnosis of cancer, which many general practice veterinarians can achieve. There might be a skin mass on the surface that is tested with a needle or cut out. There could be a swollen lymph node that might be aspirated. So a lot of vets can actually achieve that diagnosis of cancer, but I feel as though when that diagnosis is made, it's really best that the owner takes their pet to go see a veterinary oncologist. Okay. And this is a veterinarian that every day, day in and day out, treats cancer. So they best understand what are all of the options: chemotherapy, radiation, possibly doing nothing and doing kind of more of a palliative approach because maybe the pet is very far along in life and very sick and doesn't have a lot of time left, and therefore starting a treatment might be a little bit more than what is appropriate for the pet and for the owner. So I always suggest getting a referral to go to see a veterinary oncologist because they will know the most appropriate steps for your pet. And you can find one. Like if your vet can't refer you, you can go to the you can look up like how do I find a veterinary oncologist online. There's the American College of Veterinary Oncology, and so you can find one in your area. It's very doable.
I do know that there is a research center here in Colorado, I think in Denver or nearby, that is studying dogs and cancer and how it relates to people.
Colorado State University, which I think is in Fort Collins, is one of the premier cancer research universities.
Yeah.
So you have your options nearby. Hopefully you won't need that, but if you don't have, say, a specialty private practice in your area, then a lot of universities, because they're training veterinarians how to become practitioners, have departments of oncology.
Wow, that's very good. So yeah, now let's get into some of the preventative measures and what should we be doing as pet parents?
So certainly there's a couple things that I stress to my pet owners. We want to try to make sure that we're not having kind of extremes of health and extremes of illness. So we always want to try to maintain a very status quo in the body, because when you do have, say, extremes of inflammation or extremes of infection, that's when cells can change. Kind of like always going in and going in a tanning bed. You're exposing your body to extremes, and that's when cells can change. From a day-to-day health perspective too, maintaining a slim body condition in your pet is very important, because there are multiple types of cancers that are associated with being obese. And also obesity, fat cells turn on certain types of hormones that can trigger inflammation. And if your body is chronically inflamed, normal cells will change. So maintaining a very slim body condition throughout life.
Not so many treats, folks.
Fewer treats. And also the food itself, like we're so used to like dogs and cats eating dog and cat food, but it wasn't always like that. We used to share our human grade whole food with our pets, and then as a result of our need for convenience and the ability for us to make foods that are nutritionally complete and balanced, that meet all nutritional demands, which I don't really think that exists personally, doesn't exist for people, and yet we decide it exists for pets. Pets end up eating foods that are lower quality. Like your typical kibble is made from feed grade ingredients instead of human grade ingredients. So that's why I partner with companies like The Honest Kitchen, which makes food very similar to how it exists in nature. That's all human grade, because human grade foods are less likely to have toxins, some of which are even cancer causing. Like very commonly on grains that are in pet foods, mold-based toxins called aflatoxin will develop. Molds grow on grains very commonly, and in feed grade grains there are higher allowable levels of these toxins. So you could be feeding your pet cancer causing agents every day. And definitely look at like pet treats. Pet treats are one of the worst areas. Anything that looks like fake meat, like I'm not going to name any names, but things that look like fake bacon or little sausages. Those are some of the places that actually have cancer-causing agents in there, like BHA and BHT. Look at your pet food treats, and if you see BHA or BHT, throw it away, because that is a known cancer-causing agent. And you could be feeding your pet something that causes cancer every day.
So we also
super careful.
Yeah, we also don't want to cook our dinner and that's what we feed them. One of the things that I get concerned about, and I totally have finally come around to the way you're discussing and talking. I mean, for years I fed grocery store food, and my animals were healthy, but you know. Since starting BlogPaws, I've learned so much from people like you, Dr. Mahaney, and some of the members of our community. They're just so smart. And in the end, it isn't that I should cook myself a steak and cook my dog a steak, or give my dog peas because I'm having peas. It's being thoughtful and understanding what you're saying is the nutritional requirements. So people need to learn to read pet food labels. Look at companies like The Honest Kitchen and Only Natural Pet here in Boulder, where we get our pet food, and we don't cook it up ourselves on the stove, but we mix it up together. It's not, it doesn't come in a pre-packaged kind of thing. It's in a bag where we have to put it together. And they love it, and I think they're healthier since we started feeding them that. So I don't want to go to well, here, just feed them from the table. That's not what we're saying.
I agree with that. But there often is room for you to incorporate some of the healthy foods that you were eating. Say you were eating some freshly steamed spinach without like butter and garlic and stuff. You could always incorporate that into your dog's dry food just to give a punch of real
Yeah.
nutrients. You could reduce the dry food portion by like 30% and add a various combination of vegetables. I like to think about taking vegetables having different color. A pale vegetable like cauliflower, which is high in fiber and moisture and has lots of nutrients. A bright green vegetable like baby spinach, and then maybe some carrots or sweet potato. And you could simply steam that, puree it, or chop it up fine and add it into your pet's food, take away a portion of their dry food, and probably give them more nutrients that their body can absorb, because the body absorbs nutrients differently that are natural as compared to, say, like synthetic vitamins and minerals that are put into most pet foods. So there's
Yeah.
ways you can do that, or if you could always work with your veterinarian to do a nutritional consultation with one of the veterinary nutritional services that are available in this country, like the Ohio State University or
Mm-hmm.
University of Tennessee, very close to where we'll be going in Knoxville in a couple months.
Yeah.
And
Yeah.
they make specific recipes that can help pets either in their state of health or illness if the owner wants to do home prepared foods.
Yeah, I'm amazed and just impressed by all the new veterinary focus on the health and welfare, and not just here, bring them in and have vaccines as it was when I was a kid, and
Yeah.
I'm way older than you. So we have a nice long comment here from Elizabeth Keene about her cat. So we want to make sure that we aren't leaving cats out. We are talking
Okay.
a little bit about dogs because we have Cardiff, who's a good example right there, and he's being awfully good. I just got to tell you. And so she has a nice long discussion here on what is happening with her kitty, which we probably can't get into a lot of information. But she wanted to share. I'm glad she shared. I hope other people can see it in the comment stream. Do you have any comment, Patrick? Can you kind of look through?
So her cat, there's a concern for lethargy and loss of appetite, some of the signs that we discussed before.
Yeah.
If ever your pet suddenly isn't eating, it may not just be the fact that they don't want that particular food, which is another reason why I suggest we should vary our pet's diet. It shouldn't be the exact same food day in and out. The protein source should change, the carbohydrate source should change. And so in her cat, they found that she was bleeding somewhere in her abdomen, and one of the concerns was there could be cancer. And that's a very valid concern, because if there is some kind of blood that's accumulating in the abdominal cavity, your abdomen's like a barrel filled with organs. Like when you say your stomach hurts, you're saying your abdomen hurts, because it could be your stomach, your spleen, your liver, your kidneys, your bladder, you don't really know. So blood that's collecting in the abdomen could be from an organ like the spleen or the liver that could have a tumor that's leaking blood from it. Very commonly, those very vascular organs like the spleen or liver will get small tumors that will get bigger and kind of outgrow the casing that contains them, and they'll start to leak blood, and that's when a pet will definitely become lethargic. They'll start breathing harder because they don't have as much blood to support their oxygenation. They may not be able to get themselves off the ground. So I think pursuing the ultrasound, as our question asker here, is definitely an important thing to do. The steroid injection certainly can help to reduce inflammation and promote her interest in eating, drinking. That's a good idea. And the Chinese herb, which you mentioned, called Yunnan Baiyao, which is it's kind of an unusual spelling, is certainly something that is well known in the veterinary community to be a common agent that can help blood from not clotting. So if you have a bleeding problem, that could potentially help blood to clot. Cats who don't eat that well, it's hard to get this into them if you're sprinkling on the food. So you may want to actually keep it in capsule form and try to pop it right down her throat, maybe coat it in a little bit of something that's tasty for her. So hopefully we're going to get a diagnosis to determine what's going on. And if it is, say, a tumor on the spleen, that cat can have surgery to remove the spleen. But it's important to also determine, is this somewhere else? Could it be in the liver? Could it be in the chest cavity? So make sure like x-rays of the chest and abdomen are taken. And if they do go to exploratory surgery, then they can hopefully stop the bleeding and find out what's going on.
Well, Patrick, this has just been fantastic, and I think we probably could go for another half an hour or more. But it's time to wrap up.
BlogPaws.
Yes, and that's what's going to happen. I hope everyone comes to BlogPaws. Patrick will be there. He's going to go into more detail. Are you bringing Cardiff?
Cardiff is not going to come this year, in
Okay.
part because his health is a little fragile. After this year, after he went through chemotherapy, he had another episode of his IMHA,
Oh no.
partially because we took him off the medication that was controlling it, because nobody knew if we should put him back on or not. Not myself, not the oncologist I work with, not the internist I work with. So we
Wow.
decided to see how he did off of it, and 4 months later he developed another episode, which has been resolved. So Cardiff is going to stay home,
Okay.
and he'll be sending good cheer from afar.
Well, excellent. So I hope everyone will come to BlogPaws in May in Nashville and see Dr. Patrick Mahaney. And before we sign off from BlogPaws Cares and BlogPaws Shares, Patrick, I have to ask you, what is your pet project these days?
Oh well, they never end, and they keep on popping up. One cool thing is this coming Wednesday I'm making an appearance on the Hallmark Channel's Home and Family, which is filmed in Los Angeles at Universal Studios, where I'm going to talk about pet dental health, because February is National Pet Dental Health Month, so we all should
Yeah.
be every day cleaning our pet's teeth like I do with Cardiff. I brush his teeth every day and sometimes use antiseptic wipes. And then this past fall, I contributed to a project called Animal House that I think you guys are familiar with, where
Mhm.
myself and some other people in the pet industry, trainers, pet rescue advocates, went to Othello, Washington, Eastern Washington, and helped to build a shelter for a community that has a very kind of down and out shelter. So we filmed the pilot. Hopefully the shelter will be opening officially soon, and we'll be able to take that into a larger scale and go to other cities and help them to have a better shelter system.
Wow, yeah, we love that. We love that. We think that's a great idea, and we will support that any way we can. So before we sign off, Carol has one last question. Is IMHA preventable?
Yes, Carol, that's absolutely, and I would love to talk to you about that as often as you want. So, IMHA happens when the immune system is triggered excessively, and that can happen as a result of certain things that you think might be helping your pet, like vaccinations. So that's why I always suggest very judiciously vaccinating. And if your puppy and kitten has been appropriately vaccinated throughout their puppyhood, their immunity might carry on for much longer than the recommended vaccine interval. And that's why I suggest talking to your vet about doing vaccine antibody titers, which means testing your pet's blood
Okay.
to see if they have sufficient immunity from a previous vaccine. There could be a legal issue in some places because rabies is legally required in all states.
Mhm.
But in California now, actually sick pets can be exempt from having repeat rabies vaccine if they've been appropriately immunized previously and are under the care of a vet who can vouch for their immunization. So I suggest minimally vaccinating, keeping their body weight slim because you don't want that unnecessary inflammation, keeping the teeth very clean because this is a big source of inflammation and infection that affects all body systems, the heart, the kidneys, the liver. And then
Mhm.
be careful with like bee stings sometimes can trigger an immune system response, as can snake bites. So always responsibly walk your pet on a leash and don't let them walk through a field of flowers that have just fallen off of a tree where bees are humming around.
Interesting.
Prevent your pet from jumping into the bushes when you're hiking, where a rattlesnake or another snake could just be waiting there. So keep your pet on a short lead, ideally not an extended lead, a flat lead, so that you are in control of their actions all the time. And don't let
Excellent.
them outside in the yard unobserved because you never know what they're going to get into out there. I always
Yeah.
suggest knowing exactly what's going on with your pet at all moments of the day if you can.
I agree. Well, Patrick, thank you so much. This will also be
Sure.
up on BlogPaws in the next
Oh,
few
good.
days, so people will be able to refer to it. It will be on YouTube, obviously. It's a Google Plus Hangout, and I know people will be able to refer to it again and again. I'm looking forward to seeing you in
Likewise.
BlogPaws.
Thank you.